The Getting to Zero campaign, backed by the United Nations, runs until 2015 with the goal of zero new HIV infections, zero discrimination, and zero AIDS-related deaths. The Millennium Development-related goal of getting to zero comes after extensive discussions with hundreds of organizations, including people living with HIV, health activists, and broader civil society. The Caribbean community has joined this global response to HIV in an attempt to turn the tide on the epidemic. Recent figures for the region have shown a decrease in the number of new infections. However, at the AIDS 2012 International Conference, key highlights came to the fore that may be preventing the region from achieving the Getting to Zero goal. Coming to the fore was the lack of access and confidentiality within healthcare systems. Regional Prevention Advisor based at the Pan American Health Organization, Dr. Sonia Caffey, says strict confidentiality must be strongly adhered to prevent driving the HIV epidemic further underground.
One of the things we have also observed that really continues to limit a comprehensive HIV response is to ensure that everybody has access and confidence in the health system. The whole issue of confidentiality, that people will feel confident that their information will remain between them and their health worker, is really an obstacle in small communities because people might not be ready to share their HIV status if they might hear that they test positive for HIV, and people might not want others to know until they are ready to share that information. And that is really, it stops people from seeking testing, and that has a cascade effect.
The lack of confidence in the region's healthcare system has increased fear of stigma and discrimination and has led many people living with HIV to seek healthcare from other countries rather than their home territory. This has impacted negatively on several areas, including an overall decrease in access and services due to the high cost of travel, as well as a false reflection of what the HIV epidemic may look like in a country. Co-chair of the International AIDS Conference, Dame Suzette Moses Burton, says an even more serious impact looms for people living with HIV.
For somebody who accesses care outside of their own country, it means that they're unable to have the kind of consistent follow-up that they will need. A person living with HIV has to be on treatment for the rest of their life. They have to be adherent and compliant if they want to have maximum benefit of the treatment. And without a physician, guiding you through the process and being able to sort of monitor your compliance with your treatment, that can have significant impacts, negative impacts on the quality of your health.
Among the goals of the Getting to Zero campaign is a zero-tolerance approach to gender-based violence. Alexandrina Wong represents Women Against Rape, WAR, based in Antigua and Barbuda. The organization offers services to victims of sexual violence and supports migrant women to access healthcare, counseling, and legal referrals.
One should never underscore the interrelatedness and interconnectiveness of sexual violence and HIV/AIDS. Sexual violence, as defined by the World Health Organization, is a pervasive global health and human rights problem. The persons who suffer mainly from sexual violence are women. And so our organization focuses primarily on getting people to have their post-exposure prophylaxis done as a preventive means.
Only 1/3 of the 15 million people living with HIV and in need of lifelong treatment are receiving it. It's hoped that a new attitude within the Caribbean healthcare systems, promoting greater access to care through confidentiality and trust, will be a front runner in the Caribbean's response to the HIV epidemic. Amanda John, Brainstorm Productions Grenada, with a special report from Washington for the Caribbean Broadcast Media Partnership on HIV.